first point of call, local health providers around GPs in particular. Are they ready? Not just in principle are they ready, but are they really poised to get the job done? I spoke to Ruth Rankine, head of primary care network for the NHS Confederation, which represents NHS health providers.
If you think about general practice now, you already have nurses who vaccinate babies and give vaccinations anyway to members of the public. In order to give the COVID vaccine, it would require, according to the guidance, 1.5 hours additional training online.
One of the issues is whether, if for example, you have to keep this thing at a very cool temperature, and I know it can be kept in a fridge, this Pfizer one can be kept in a fridge for some period of time, is whether fewer centres in a kind of mass production format would be better than having lots of people drifting into the GP's normal office. Is that something you would imagine being possible? Is it something you can do outside? Can you open up a kind of a bay in a car park and just have queues of people coming along in the outdoors, multiple tables, giving people the jab and doing it more quickly that way rather than them, if you like, checking in at a GP surgery?
So I think as the supply of vaccines becomes more available, then that is something that is being looked at in terms of a mass vaccination programme coordinated at a much higher level than general practice, but obviously starting with general practice in terms of the prioritisation of those that will be vaccinated first in line with the supply of vaccines. So as we understand it, although we haven't seen the detail yet, they are looking at the potential for mass vaccination centres in the way that, we have seen in parts of the country for this year's flu vaccination.
Yesterday, John Bell, very senior scientist on the government's vaccine task force, said on The World at One he was confident that life would be back to normal by next spring. He wrote back a little bit on that today, talking to MPs. He said 80% chance as long as we don't screw up the distribution of the vaccine. In a way, this is where your primary care network and NHS Confederation comes in, isn't it? It is going to be down to you not screwing up the distribution of the vaccine. Are you losing sleep over this? What is it that worries you? What is it that might go wrong here? Because we know that lots of things have gone wrong in the handling of COVID since the spring on PPE and on testing. What is it that might go wrong between now and spring?
Just to clarify, NHS Confederation is not responsible for the distribution of the vaccine. We represent and speak on behalf of primary care networks who are responsible for delivering the programme. There is a risk, as we saw, for example, with the supply of PPE, that there are challenges to the distribution and the supply of vaccines, which is why we are calling on as much national and local support for primary care networks to ensure that they can work with their partners in the local community to make sure the workforce is in place and the logistics and physical arrangements are in place so that when a vaccine is ready, they are ready to vaccinate people. Primary care networks will only be able to vaccinate people if they've got the vaccine.
Last thought. GPs tend to be quite busy, often quite difficult to get an appointment. They're taking on now a mega task, millions of hours of GP time or GP practice time to be spent on this over the next few months. Is this going to mean you're not going to get an appointment for many other things that you might want to see your GP for?
So there is a misconception that general practice is closed, and I'd like to reassure listeners that general practice is very much open. And where patients need a face-to-face appointment, they will get one. But we do have to be realistic that there is significant pressure on general practice at the moment and primary care. In October, there were over 6 million appointments in general practice each week. And over 60% of those were face-to-face. So general practice is very much open and busy. And yes, this will add pressure onto their workload, particularly during winter when normal flu and colds are around. But what we're saying is that actually GPs and clinical teams, clinical professionals need to be able to use their clinical judgment, and there needs to be local flexibility to prioritise what is absolutely necessary. And yes, that may mean that some non-urgent activity, such as, for example, new patient checks or non-urgent minor surgery, has to be paused. We know that our clinicians know what's best for their patients, and we should trust them to be able to use their clinical judgment to make those decisions.
Ruth Rankine of the Primary Care Network of NHS Confederation.